Hello everyone and Happy New Year and welcome back to Libreng Consulta. I'm Dr. Ana York Bondoc and thanks for following us. Hoping you're okay this holiday season. We are going to be live on YouTube and FB. So ilagay lang po yung inyong mga tanong and this is our last question and answer session for the year. Ginawa ko kong Q&A because I'm sure marami pong may tanong but we have been away because of the Christmas season and busy rin po kami sa amin pong darating na kampanya. But now, for the last day of 2021, and it's really been quite a year, sasagot po tayo ng mga tanong. Mga burning topics for the day are actually OMICRON, how to party safely, and of course, yung safety po sa paputok. So please put your questions. They may be COVID or non-COVID related, and we'll do our best po to answer them. So, salamat po, and let's go!
Letter A, what's happening po sa Omicron in other countries?
Okay, that's a good question. Anong nangyayari na? Siguro na, hindi lang other countries, pero gawin na po nating mundo. No, what's happening sa Omicron? So, would you type po Omicron update? So, what's happening po sa Omicron? Sa iba't ibang bansa po, most notably po talaga sa Europe and the United States. At the beginning of December, Omicron was only, pumapangibabaw po dun sa US was Delta. Pero, which is a variant of COVID for those who are not very much aware, Pero within 2 weeks po, it's now 40 na po, 60% Omicron ang nagiging positive po and the 40% po remains to be the Delta. So the US has never recovered from the Delta. Well, I would say never recovered. It has slightly recovered, pero may Delta pa rin po talagang umiiral doon. And the Omicron, which we first spotted po in South Africa po, and Botswana, has traveled via air travel po sa mga iba't pong travelers and has entered po the European Union, various places in Europe po, and the United States. In Asia, hindi pa po masyadong kalat, no? It's not yet that big. And we are still waiting po kung makakarating or kailan. Kasi hindi lang kung kailan. Kailan po makakarating ang Omicron sa Pilipinas. So the update of Omicron po in the other countries is it is now the dominant variant in Europe and the United States in a very short period of time. Okay, next.
Letter B, effective pa po ba ang vaccines?
That question, because there have been a lot of breakthrough infections. Ano nga po, could you type breakthrough po, no? What is a breakthrough infection? A breakthrough infection is an infection po with someone who has been vaccinated twice, and it may also occur po when someone has even been boosted. So marami po tayong, hindi naman marami, but nakakarinig po tayo ng mga tao po na who have been vaccinated completely with booster shots and nagkakaroon po ng positivity sa Omicron. Wait lang, let me type ayan, breakthrough. So that is called a breakthrough infection. Of course, most of the infections rin po are in the unvaccinated. And this is very, very important. I think there's another question gonna come through na people are asking, dapat pa rin hubang mabakunahan kahit nagkakaroon po ng breakthrough? Kasi nade-depress po sila, na 3 na po yung bakuna nila, nagkasakit pa po sila. I would like to stress to everyone, studies have shown that if you are vaccinated po, yung chance nyo talaga ng hospitalization, ICU, and death, mas mababa po talaga kung ikukumpara sa hindi bakunado. So, if you are vaccinated po, and even better kung may booster, malakas po talaga ang protection nyo versus serious infection, hospitalization, and worth vaccinated pa kahit positive mga 3 times pong bakunado. Kasi kakahawa ang Omicron, sobra po talaga kakahawa. It can become positive to someone who vaccinated 3 times. Pero, the good news, hindi pa rin ang protection niya versus hospitalization, ICU, and that.
Letter C, what's effects against severe disease?
Against severe disease talaga, well, there's the new drugs po, pong bagong mga drugs po, no? That are now being used po for severe disease. But again, the most effective po rin talaga and what is giving a lot of people protection ngayon po, yung kanila pong 3 doses of vaccines. I would like to stress, no, ngayon po talaga, hindi na po pwedeng dalawa lang. It's really good to get a booster and it is now considered complete po. Or at least, hindi kayo kompleto kung wala kayong booster. What will happen in the future, hindi pa rin po natin alam. But ako po, I've been boosted with Pfizer. My first 2 shots were Sinovac. My booster is Pfizer. Dr. J, 2 shots Astra, booster Pfizer. So, the FDA, the Philippines has shortened po the period of time. Dati po, 6 months. Ngayon po, 3 months pa lang pwede na po magpa-booster. So, if you've been vaccinated 2 times, pa-booster po kayo.
Letter D, mas mild ba talaga ang Omicron?
Yes, many studies are now being shown across the European Union po and the US na mas mild po talaga, less ang hospitalizations po ng Omicron. This is a combination of 2 things. Maybe the Omicron is really mild or maybe number 2 po, yung the vaccines are really protecting people po. So a combination of these 2 elements po. It's possible that Omicron itself is mild or it's possible po na yung prior infection has given antibodies and then po yung vaccine has antibodies. So combination of that, mas nagiging parang nabababaan po yung bagsik po ng virus. But again, no, wag po tayong umasa na mild lang po si Omicron. Kung kayo po ay older than 65, marami po kayong sakit, it can be a big problem pa rin po. Ano? That's why it's very important for the seniors to be vaccinated. Kasi po, pag po yung immune system nyo due to Omicron, and then for example, nakadialysis kayo, may sakit sa puso, ganun po, the other complications may set in and this may actually cause you to be in the ICU. So yes, it looks like Omicron can be mild, but if you are older with many comorbidities, you should really be cautious pa rin. And then of course, yung dami po talaga. Like if everybody gets positive for Omicron or a big portion, like walang doktor, walang nurse, walang police, or kaya sila at saka yung mauubos po yung hospital resources natin. Magsisiksikan na naman talaga tayo sa lahat sa ER. Kasi let's face it, nervyoso po yung mga Pilipino. So if someone's mom gets positive for Omicron, talagang hanggat maaari po na makakayanan, pa-hospital niya talaga yun. Whether it's mild or not, SNED lang po. So the sheer number po, people will be rushing to the ER, posible po talagang ma-overwhelm, mapuno po yung mga ER. Okay? So the government has to do a good job po talaga vaccinating everyone, educating everyone na you don't need to go to the ER unless may nangyari. And number 3, kailangan po yung mga LGU gumaling po sa kanilang home care. At saka pag-monitor po ng mga tao sa bahay para kumalma po yung tao and they don't all come rushing to the ER. Kasi pag nagsiksikan po dyan, yung mga nasagasaan, nasaksak, nabarel, na atake, wala po silang place sa ER because it was all filled with Omicron patients na hindi naman talaga kailangan nasa ER and possible to, hindi maalagaan talaga yung mga dapat. So yes, it looks like it's milder, but if you are older with comorbidities, you should take much caution. And number 2, the government should prepare our emergency facilities kasi baka pa rin ma-overwhelm pag marami. And number 3, our LGU should be prepared also to help yung mga kababayan po natin with their home care kung sakali.
How effective is travel quarantine? Nako, napaka-controversial nito, Doktora.
Yun na nga, I'm sure lahat kayo nakarinig na ng mga umiska po, no? I think what is an Omicron positive or a positive person escaped
The
po.
poblacion girl.
Yes, wag na natin banggitin yung pangalan, no? But it was a lady and she left the hotel to party in Poblacion girl, ano? First of all, two things, ano? Why do we quarantine persons when they come from abroad? And what is the meaning of the travel quarantine, okay? We quarantine persons from abroad kasi po, doon nagkakalat si Omicron, okay? So it's possible that they have been exposed, wala pa po silang nararamdaman, and they board the plane and come to the Philippines. And then they escape from the quarantine and doon na ho, nagsiubuhan na. And wala na po, no? Nagkumalat na po si Omicron sa Pilipinas. It is so highly contagious. Kasi you're asking me, Doktora, hindi ba na PCR test ang mga to? Oh, yes, it is possible po, even with a negative PCR test, to still become Omicron positive. Kasi halimbawa po, na PCR test kayo, there's 48 hours before you can take your PCR test po or swab test, no? 48 hours before you board the plane. Eh, halimbawa, nagpa-swab test ka, no? Going home, sumakay ka ng taxi. Umubo yung driver sa loob ng taxi. Oh, and then after that, the next day, sumakay ka na po going to the plane, ano? So, paano yun? Your PCR test is negative, but you became exposed to the driver and sumakay ka ng aeroplano and then you went to the Philippines and doon ka na inubo. So, if the travel quarantine, yung negative PCR test is only, it's only a precaution. It's not 100%, okay? So, we quarantine people because Omicron is coming from another country. And number two po, matagal po yung quarantine natin eh. So, hopefully, they will catch the Omicron at hindi na ho kayo makapag-spread po sa ibang tao. And that is why we quarantine people. Kaya lang, no matter if we PCR or quarantine people, kung umiiska po naman po sila, wala ring mangyayari. So, ako po, no, people who are, escaping from the quarantine, sa akin po talagang dapat merong consequences po sa nangyari. Hindi po pwedeng sorry na lang, ano po. And ito rin, pag-isipan mo tayo, what's your comment on this? The hotel is only, kumikita lang sila. They're not naman police. Hindi naman sila yung, sumsusi nila yung mga kwarto nyo. So, if ever the PNP wants to really be serious about this quarantine, magpalagay sila ng PNP dun sa lobby ng hotel bago makalabas yung mga tao. Kailangan mag-check-in, check-out po talaga sila sa police. Kasi, the hotel is a hospitality facility, hindi naman siya jail. So, parang yung staff, hindi naman talaga trained. What if nag-i-insist yung guest na lumabas? Ano po? So, talagang, it's not 100%. And mas lalong grabe kung hindi naman po re-respetuhin ng mga taong nagpapa-quarantine. Ikaw, Reyna, what's your opinion on this?
Naku, Doc, ako nalungkot talaga ako kasi we are already we are enjoying na all of our hard works, no, for the past years. And then suddenly somebody made not a mistake made a conscious
Hindi, talagang, conscious effort niya yan, Reyna.
Made a conscious decision and nagkalat ng virus. And I would have to, dagdagan ko lang po yung sinabi niya, Doktora, na nagtatanong, bakit hindi naman nalaman ng RT-PCR, negative naman siya. It was after 5 days na nalaman na positive siya. It was only after 5 days na nalaman na nag-positive siya because of one of the few people na na nag-positive siya. And then they tested kung Omicron ba ito. And then yun na nga, nag-test nga yung balikbayan. Nakakalungkot lang. In my own opinion,
Very sad.
Yeah. Doon naman sa hotel facility, yung nako talaga. I mean, really, I agree na hindi sila yung dapat nagpo-police. But then again,
may responsibility din
sila. Especially if the person declared na ginamit niya yung connection niya. Diba?
Ayun. Nagmalakasan pa.
Yun ang masakit. No? Yung connection na supposedly who will protect you, kaya ka may connection, diba? Somebody to protect you, hindi ka na protektahan. Nag-spread ka pa ng New Year. Hindi tuloy happy ang New Year ng mga taong na-ospital. May mga na-ospital, Dok, eh. So, ayun. At dumodoble ang case. It's exponential. It's not times 2 times 2.
Ganun po ang Omicron talaga.
Yes. Yun lang ang opinion ko doon. Sad to say na may poblasyon girl na who uses the connections. And ayun
Very
lang.
sad.
Very sad.
So yun. Talagang malungkot. Okay.
Yes.
Dapat seryosohin natin to and there should be consequences. I'm sorry.
Okay, next. Okay, next po. Okay, next question na yata tayo, no? Letter F, how to keep safe ngayong New Year. Yan, doktora, inaabangan nila to lahat.
Napakaganda talaga, no? The question is, nandito na ba si Omicron? Or could this be a Delta surge? Okay? Could this be a Delta surge? Yes, it could still be a Delta surge because Delta is here. Hindi naman nawala talaga, bumaba lang because of the hard works and efforts of everybody. So it's possible po that Delta thrives in crowded situations, not wearing masks. Ayun nga po, that's why it could still be a Delta surge. Kung pwedeng Omicron po ito, yes, it's also possible. And it's even scarier po kung Omicron po talaga to. So what to do po, no? First of all, let's analyze, ba't nga ba tumataas sa mga Western countries? Kasi po talaga, yung mistake po nila is that they assume that vaccines would protect them. So tinigil na po yung social distancing, they don't want, nakikita po sila, it's winter, nakikita po sila sa mga bars, so hindi po mabuksan yung mga bintana. So it's a combination of siguro overconfidence on the vaccines. Unfortunately, so kahaba po talaga. We cannot rely on vaccines to protect us. Social distancing, limiting, getting together, and wearing masks po talaga in open air. Yun po talaga yung strict na apat na talaga pong kailangan nating malaman. So how should we go around this New Year's? Kung kayo po, ako party with caution. Kasi ayoko naman hong sabihin na hindi. Wag na natin sabihin, the term is not party, okay? I don't think you should be attending parties. Ganito na lang, get together with your family with caution. Okay, yun na lang. I think that is really the best advice that I could give. Kung outside po ng inyong immediate family or mga talagang close, wag na ho tayo masyadong maghalubilo. And let's keep the interactions to small groups. Halimbawa po, magkakapatid na lang po. At kung ninenervyos kayo, it's also possible na kung ayaw nyo talaga, I understand, okay? Ayaw nyo talaga, please, intindihin natin yung mga tao. Siguro yung mga 40 people, large weddings, closed venues, parang ninenervyos na naman ako with this going on, ano? So I would say, get together with your close family with caution. Make sure your venue is open-aired po talaga. Kung magiging in a place po na sarado, please try to open na lang the windows and use the electric fan po. Kahit po mag-aircon kayo, strictly open the windows, okay? Number 4 po, please try to wear mask and remove mask na lang po pagkakain. Caution sa for those who are seniors, maraming sakit, it might be a good idea rin if you want to skip it or you don't want to eat or you want to stay lang po sa labas ng bahay or venue na medyo nakikihalubilo but safely distance is okay. Alright? Again, masakit ito but I wouldn't suggest making beso-beso, galamano or shaking hands and mano. This is not the time. Fist bump na lang po o elbow bump. That is what I would suggest. Kung magkakaraoke po, remember that singing also spreads a lot of aerosols. So baka naman you want to put the karaoke singer mag-isa lang dun sa tabi, okay? And then, again, drinking, mental health, kailangan din naman pong uminom, but again, with caution po. Kasi pag nalalasing, nawawala po yung social distancing, nawawala po yung pag-inom. So I would agree, it's okay to drink, pero with caution. So that's what I could suggest po talaga. Some people are even more strict. They have canceled so many New Year's events. Sa akin po, mental health is okay. So it's okay to get together. Pero immediate family na lang po. And again, with a lot of caution at pag-iingat. And lastly, there will be a lot of disagreements na naman netong New Year about some people don't want to get together dahil suspect nila, yung iba hindi naman nag-iingat, yung iba naman masyadong maarte si kapatid, yung iba naman po beso-beso kay nanay, yung iba nagagalit. Siguro let's just follow the strict test. Kung sino yung pinakapraning sa pamilya, respetuhin na lang po natin siya. Let's do our best to follow them. Wag po nating sabihin, ay praning ka naman. Kung ganun po talaga yung feeling niya, let's respect it. And lawakan po yung pangunawa. Kasi there will be a lot of misunderstandings. People who will cancel not going. People will be calling each other KJs, ganyan. Pero respetuhan na lang. That's what I can say. Ikaw, Reina, any thoughts?
Napakaganda ng mga advice mo, Doktora. Ma-add, just lang, siguro, let's enjoy the new year. Unfortunately, we could have enjoyed it a lot better, pero ngayon we caution na because of the exponential growth of the OMICRON, no? Dito na tayo magpipilihan. Yes, let's just enjoy ourselves. And siguro ang matadagdag ko lang, Doktora, let's make let's list down all of our what are the things that you're grateful for on the past year for the 2021. It's magandang magandang simula na i-look natin yung mga naging thankful na mga pangyayari sa buhay natin this past year, diba, Doc?
Yes, true. Later on, I'll give you some mental health tips for the new year also and how to move forward po with caution. So, thanks a lot. This is our update po on Omicron and hopefully you learned. We'll do, siguro, true or false, let's do the paputok quiz.
Yes, let's do a little quiz. Pag naputokan ng fireworks at maliit ang sugat, no need to go to the ER? Is it true or false, Laura?
Ikaw, Reina, what do you think?
Pumunta na kayo, pero kung kung sobrang lala, kung hindi naman ganun kalala, siguro i-first aid nyo na lang. Pero kung malala naman, takbo nyo na.
Ikaw, Kat, go to the ER kung maliit or don't go to the ER?
Kaya naman first aid pa, first aid na lang po muna like hindi natin alam kung ano yung pwedeng abutan nila sa ER eh. Ayun.
Okay, ito yung take ko, no? Ito yung take ko talaga. Any fireworks wound must be injected po with anti-tetanus. The best place to do that is in the emergency room. Actually, ang hinahabol po natin sa sugat ng paputok, hindi po, obviously, kung natanggal yung daliri nyo, you have to go to the ER. But kahit na maliit lang po, basta may lumabas pong dugo talaga doon, a fireworks po is considered a dirty wound. Okay? And even if it's only small, it might be deep po. And doon po papasok yung Clostridium tetani. So, ako nakita ko na to talaga sa PGH. We encourage people to go to the ER, not to treat the wound itself Kasi you can do the first aid in the house. You put betadine, linisin po, scrub well. Those are the first aids. But, any fireworks wound is considered po automatically a very dirty wound and a potential po for tetanus. And that is why you should go to the ER para po mabakunahan. Not para linisin yung sugat. You can do that at home. You need to go to the ER para mabakunahan. Okay? So when should you go to the ER? Ako, I would advise as soon as naputukan kayo, go to the ER. Pero if it's like 11 o'clock at night at talagang punong-puno yung ER, the next day, in the morning, pag tumahimik na po lahat, go to the ER. Not to clean your wound because I presume ginawa mo na yun sa bahay, But to get your anti-tetanus, there will be the teana po, that's the toxoid. That's for the immediate antibodies. And then the long-term for you, the vaccine for you to produce your own antibodies. Okay? So, we are going to the ER not for the first aid. I hope you did that at home. Linisin mo yon, okay? We are going to the ER for the anti-tetanus shot. Okay? Next po.
True or false? May nahihika sa usok ng paputok.
Nako, Ikaw, Reyna.
Nako, doktora, ako, may allergic rhinitis ako, may asthma din. Pagka New Year, nagtatago ako sa loob ng kwarto.
True.
Sad to
Okay,
say,
Kat. Ayan. Ikaw, Kat, may nahihika ba? Yes, ano?
Yes
Yes.
po. Tsaka
True.
yung amoy kasi ng usok ng paputok, di ba, Dok? Parang hindi
Yes.
ganun.
Yes. It happens, okay? Kasi ganito po yun. When I was working in PGH po, I was in the Pedia ER. So, meron kaming Pedia ER at meron kaming surgery ER. So, lahat ng naputukan, they were in the surgery ER at 12 midnight. So kami, nasa Pedia ER, kain-kain lang kami doon, happy-happy. Kasi walang laman yung Pedia ER. We thought, wow, non-toxic yung duty namin. Aba, mga 2 o'clock nagdatingan yung mga hinihikang bata. Ang daming naka-nebulizer. Oh my God. So basically, we had our own emergency there sa Pedia. So yes, it is true po. If you have allergic rhinitis, asthma, COPD, problema po sa baga, do not expose yourself po to the smoke. Ang hirap no, talaga, dapat open air, But, sige, electric fan nyo na lang ho palabas sa inyo. Baka makatulong ho yung mask, Mask filters smoke also and bad odors. So, wear your mask and again, keep out of smoke kasi baka po hikain kayo.
True or false? Itali o itago ang mga aso dahil natatakot sila sa sobrang lakas ng paputok.
Oh, ikaw, Reyna, what happens to your dogs?
This is very true. Nai-stress sila, Doc. Lalo na dun sa yung biglaang yung mga malalakas na sounds. Tapos yung tuloy-tuloy na sound, they are shaking. Yeah. Trembling and shaking.
Yeah, kawawa yung mga dogs. Oh. Ikaw, Kat, do you have a dog?
Yes po. Yung bigay po ni Bench. Doc, ako po siguro ikukulong po talaga dapat. Kasi pag may narinig po silang mga paputok, minsan magpapanik po sila, hindi nila alam kung saan sila tatakbo. May tendency matamaan din po kasi sila ng paputok. Ayun po.
Yeah, our dogs were hiding inside our house. So, yes, kung marami pong paputok, please take care of your dog. Itabi nyo na po or put them in a safe place kasi they will really get scared and kawawa naman sila.
True or false? Eating or swallowing watusi is poisonous. Nako, yes, very true.
Yeah, oo. Guys, marami ako nakita sa PGH na mga, kumakain ng mga watusi. Kasi, these are the smaller kids kasi the 12-year-olds, they're exploding it there sa labas ng bahay. Then, they leave it lang nakakal. And then, the toddlers, they come by, it looks like candy, so they put it in their mouth. It is very, it is poisonous. Poison po yan.
True or false? Immediate concern ang tetanus pag naputokan.
Yes, ang immediate concern talaga is, of course, kung pumutok po sa mukha nyo or natanggal po yung daliri nyo, then the immediate concern is yung wound. But the immediate concern for smaller wounds talaga po is tetanus. For both small wounds, small and big, is tetanus. So if you happen to go to the ER po talaga, ang daming binibigyan po ng tetanus shots. So tetanus. Word of warning po, tetanus, it's a deadly disease. Konti lang po talaga nagsosurvive. There's almost 85% death rate. Basta mataas, you will need to go to San Lazaro. It's a lot of money spent. Big problem po talaga. So kung kayo po ay naputukan, whether small or big, by a firecracker, at may obvious na sugat, patetano nyo yun. Okay? It's better to be safe. And anyway, the tetanus vaccine is good for everyone. It lasts for 5 years. Kung madapa kayo or what, at least nabakunahan na po kayo. Okay, so tetanus. So let's read any comments from our friends po or may nakikinig. Or may tanong.
May last letter pa po.
Meron pa last.
Next one, true or false? Anti-tetanus po ay iniinom at nabibili sa botika. Sorry, botika.
No, yeah, no, you do not drink anti-tetanus medication. You cannot, well, you can buy it in the botica, no? Kasi you can buy the vaccine. You can buy it, but the best place talaga is the emergency room kasi po tinuturok siya. Hindi po siya iniinom, tinuturok. Okay, that's 2 shots.
From Miss Wanli Olmilo, Mr. Wanli Olmilo, good morning, Doc. Ano po ang gamot sa sumasakit? Nasakong ko, pag lumalakad ako at tumatayo, hindi ko po maiapak ng mabuti.
Alam mo, this is actually quite common na sakit sa sakong eh. Plantar fasciitis po, it's a inflammation of the plantar fascia. May exercises po talaga dito. Sometimes some people have calcium spurs po sa kanilang paa, so you probably, if it's not getting better the exercises, you're gonna need an x-ray. So yun po yun. Try the plantar fasciitis exercises. Wait, let me type it po for everyone's knowledge. Ano po? Plantar fasciitis. Masakit to Oh. So the plantar fascia, it's under your feet, sa ilalim, and it can get inflamed. Ang sakit-sakit nun, grabe. Opo. I just typed it. Give them a few minutes po to type the sickness. Ayan, plantar fasciitis. Inflammation of the plantar fascia. Okay? Exercises po. Bigla lang mo nawawala yan eh. Sometimes it also has to do with the kind of shoes that you wear. Next po. Wow, ang haba.
From Mr. Mark Joseph Tulmo Franco, good morning, Doc. Ask ko lang, may history ako ng PTB, pero natapos ko ang gamutan last September 23, 2021. Then mga November na ulit ako as a merchandiser. Tapos, recently lang, pag bumudura ako, may blood ulit. Tapos, nagpaulit-ulit. So, nagpa-check up ako ngayon. Nga daw, may pilat na daw kasi yung baga ko. Bawal na daw ako yung sa mabibigat na activity. Tanong ko lang, Doc, may possible po ba bumalik yung TB ko? Any advice po kasi sobrang bothered na naman po ako sa nangyayari sa akin. Sana mapansin niyo po. God bless.
Sorry, I didn't hear anything. Putol-putol yung ating internet connection. Would you like to type the question simply? I also cannot, I also cannot see it on my iPad.
I-summarize
Anong problema?
I-summarize ko na lang po, Doc. Nagkaroon siya ng PTB. He is asking if possible daw po bang magkaroon ulit ng or mag-relapse ulit ang TB niya. Kasi
Hindi
right
talaga
now,
naririnig, putol-putol po. Paki-type lang po yung tanong simply. What's the question? Sorry talaga, hindi po na-pick up. Mabagal po yung internet dito. Ano po ang tanong? I'm trying to read it eh.
no, Doc, that's the different
Any advice
question.
po sa sobrang bothered na ako sa nangyayari sa akin? Anong nangyari sa'yo, boss? Sorry, pasensya na. Boss Mark, I'm sorry, Sir Mark. Pasensya na po. Wait lang. I'm suffering from poor internet. Why is he bothered? What's bothering him? Oh, sige. Wait, nakakaya naman. Balikan natin si Sir. I am
Doc,
suffering
ayun
po
yung
from
tanong.
poor internet, guys. I'm sorry.
Doc, ayun po yung tanong.
Mr. Mark's question, simply lang. Without all the
Yes,
details.
Ito na po. Ito na po, Doktora. Naka-flash na po sa screen. Doc, naka-flash na po sa
Ano
screen
ba
yung
to, guys? Sorry. Can you please type the essence of the question so I can read it na lang? Opo. Sorry talaga, I cannot even see it on my Possible pong bumalik ang PTB? Yes. Yes, that is a very good question. Is PTB able to come back? The answer po is yes. You have been treated po for 6 months. Some people for 1 year. the PTB never goes away po. It will live po dito sa apex ng inyo pong baga. Okay? Why? Because this is the area po na talaga pong pinaka-aerated, maraming air. So, PTB needs air po, no? So, it is kept in check by your immune system. Okay? Ngayon po, during a time na you've had a major surgery, dialysis, uncontrolled sugar, cancer chemotherapy, may possibility pong mag-reactivate. That is what we call reactivation TB po. And it's coming from a previous TB infection. So, yes, it is possible na bumalik. So, how to guard na hindi na po babalik si PTB? Keep yourself healthy, eat a good diet, healthy lifestyle, exercise po, no? And in the event po na you have dialysis, you have to control your sugar if you're diabetic, or you undergo cancer chemotherapy, some people po, some doctors would actually prescribe po INH prophylactically. What's the meaning of prophylactic? You just take po one of the 3 gamots para hindi po mag-reactivate ang immune TB. So, but don't panic. It happens and it can be controlled, okay? Thank you, Sir Mark. I apologize for not being able to read the question. Malayo po kasi yung screen. It's very small and super bagal po si internet dito.
From Mr. John Matthew Undayan Kasipong. Good morning po, Doc. Tanong ko lang po, if sumasakit yung mga balakang ko, may possible po ba na may problem yung kidney?
You know what? Don't worry about these kinds of things. The way, kung sumasakit po yung balakang nyo, have a checkup. Wag hong mauna yung pag-iisip na baka ganito, baga ganyan, kasi nakakatakot po yun. Don't do that. To check your kidney po, do a urinalysis, do a BUN po and creatinine test, is a blood test. And pwede pong i-check po ng doktor yun. But yes, kung pinapalo po yung likod, there's a kidney punch na tinatawag. Kung masakit po yun, well, have a checkup. I wouldn't say that it's your kidney. I wouldn't say that it's not your kidney. But don't torture yourself po the It's possible, pero the best, checkup po. Okay? Huwag po kayong maunahan ng nervyos na baka kidney. But again, kung may nararamdaman kayo, hindi naman ho maganda yung i-ignore. So, check up.
From Mr. John Matthew Undayan Kasipong. Doc, tanong ko lang po kung anong ibig sabihin ng polycystic ovary.
Ano po? Polycystic, PCOS. Is this PCOS, polycystic ovary or polycystic kidney? Ano, polycystic what?
Ovaries po, Doktora.
That's called PCOS po.
Yes.
Polycystic ovary syndrome. I'm not an OB-GYN or an endocrinologist, so this is not my favorite topic. But the meaning po is PCOS. It's a syndrome po of events which may lead to infertility. So if you do have PCOS, see an OB-GYN.
From
Sige po.
Mr. Jones Puno, good morning, Doc. Ask ko lang po kung ano po magandang medicine or remedies sa may pabalik-balik na migraine. Hope you notice this po.
My best advice po is to consult a good neurologist. There are many new migraine medications ngayon po on the market. So patingin nyo po and they will be giving you a series. Actually, I would like to do a neuro talk on headaches po. Maganda ito.
That's all the questions that we have po.
Okay. So to everyone, have a happy new year and stay safe and healthy po. And again, mag-ingat po tayo because the COVID cases are going up. We do not know if this is Delta, it's possible, or Omicron, it's also possible. But again, kailangan po tayo mag-ingat. That includes mask, social distancing, limiting po gatherings, and holding them po in open air. And of course, pabakuna po. You need 2 shots and a booster ngayon po. For Johnson & Johnson, you need 2 shots. Okay? At kung wala pa kayo ng isang bakuna, my gosh, ano pang hinihintay nyo? Andito na si Omicron, okay? Pabakuna na po. That is your New Year's resolution.
Okay, Happy New Year po!
Woohoo!
Happy New Year!
Thank you.